you've got to think of your thyroid as the body clock, and think of it like a metronome. So when it's running smoothly, it's a nice even beat. But then if it's working too fast, your heart is beating faster, you feel more agitated, more anxious, more worried, often feeling very hot very quickly. Equally, if your thyroid's running slow and there's a disorder which is slowing it down, then you sort of become more lethargic, often feeling more cold, and notice skin and hair changes. So disorders of thyroid are problems which happen within the thyroid, which affect often its function. But sometimes there can be disorders of the thyroid that don't affect function at all. So when we think about thyroid disorders that you're going to come and see an ENT surgeon about, it's very rarely that you're going to be seeing an ENT surgeon about an overactive thyroid or an underactive thyroid. Normally you'll see an endocrinologist for that. But when you come to an ENT surgeon, it's usually because either you've already seen an endocrinologist or you've noticed a lump in your neck which is associated with your thyroid. If you've got an overactive thyroid and underactive thyroid, it can affect other parts of your body and it can make you feel unwell because of that. Equally, if your thyroid is growing and it's really quite big and pronounced, it can press on things. It sits just on top of your windpipe, so it can press on your windpipe or move it across. It can press on the lungs, causing difficulty with breathing, and it can also affect your swallowing by pressing on this swallowing pipe or esophagus, which lives just behind the thyroid gland. Normally, you'll come and see an ENT surgeon because you've noticed a lump in your throat or a feeling of a lump in your throat. We will have a feel of your neck by placing our hands just over the front of the neck and trying to palpate or feel the thyroid, see how big it is, and then we'll take an ultrasound and maybe even a CT scan to assess it further. Depending on the size of it, we can then discuss whether there is any treatment needed, whether that be through methods of things like radio frequency ablation, or even potentially surgery, or even thinking about medications that can try and shrink the thyroid back. So if you've got a lump in your thyroid, what's the best way to treat it? Well, there is no single best way. What we try and do is aim our treatment on you specifically. We want to understand why the lump is there, what problems it's causing, and then tailor the treatment to you. If it's really big, we might be talking about surgery to try and remove that thyroid, or at least half of the thyroid which is causing the problem. So how can your thyroid affect your quality of life? Well, in multiple ways. Number one, cosmetic. Sometimes people feel as though having a lump in the front of their neck that people can see means that people don't look at them, but look directly at their throat. Secondly, it can be causing problems with your swallowing, which makes you feel uncomfortable. Thirdly, it can give you a feeling of tightness around the neck, making it uncomfortable all the time. In some people with really large thyroids, it can affect their breathing, making them short of breath or giving them noisy breathing. Equally, it's really important to think that if I've got a lump in my neck, does this represent a potential cancer? And the only way to find that out is to see a specialist, get some imaging, possibly get a needle test done, and then discuss the results with them in a calm and structured manner.